So why TB takes 6 months for the treatment? इसके स्टडीज हुए कि 1 महीना टीबी का ट्रीटमेंट देके देखते हैं तो रिलैप्स के चांसेस बहुत थे, या फिर कभी कभी एक साल टीबी का ट्रीटमेंट देके देखा तो स्टडीज में फाइनल हुआ कि मिनिमम 6 मंथ्स ट्रीटमेंट लगेगा ही. So it will require minimum 6 months treatment, max depending on the response, and follow-ups and important visits. So very importantly, now टीबी का अगर बैक्टीरिया का ग्रोथ पैटर्न देखा तो देयर आर 3 to 4 टाइप्स ऑफ ग्रोथ पैटर्न्स इन ट्यूबरकुलोसिस. फर्स्ट इज फास्ट ग्रोइंग एंड रैपिडली ग्रोइंग. So one pattern is this, one is slow growing and third is dormancy. Then now fast growing, rapidly growing, the mass is same. In average, one tuberculosis infected person, the bacillary count is expected to be 10^10. So this much bacilli are there in the person who is infected with tuberculosis and suffering from tuberculosis. So there are two things, infection with tuberculosis and suffering from tuberculosis. I had worked in tuberculosis ward for more than 30 years now. So I may be infected with tuberculosis. I may be harboring few TB bacilli, but it doesn't mean that I am suffering from tuberculosis. So I am a candidate for latent tuberculosis. If you do my latent TB tests, that will be positive. And if you do my tuberculin test, that will be positive. So a tuberculin test positivity does not only signify that I should take treatment. I may potentially I need to suffer from tuberculosis because I may be harboring bacilli of tuberculosis. So it's a health hazard. So a person working in TB wards, especially healthcare professionals, they are actively exposed to the TB bacilli, are harboring TB bacilli. They are a potential candidate to suffer from latent tuberculosis. What is latent TB? It means latent TB is now person is infected but there is no active TB. So this is latent TB. This is definition of latent TB. Understood? Fine. Now rapidly growing bacilli will be killed by antibiotics, will be killed by anti-TB drugs rapidly because the rapid turnover. For the antibiotic to act, the cell must be actively metabolizing. For example, isoniazid, the drug, it interferes with cell wall synthesis. Synthesis means metabolism active. If the bacilli is not actively metabolizing, how will this bacteria will be killed? Isoniazid will work only if the bacteria is active. So it takes longer time. It takes 6 months minimum. Like a soldier is sitting with a gun. Once the enemy comes, then he will shoot. So anti-TB drugs are there in the body. Once the bacteria starts metabolizing, it will enter. So we have to take the drugs round the clock. Now this is rapidly, slowly growing bacilli are also rapidly or fast, which is very less amount. Slow growing bacilli, and this is dormancy. अभी साधु महाराज 14-14 साल हिमालय में तप करते थे. अभी अजगर भी 6-6 महीना तालाब में डूब के रहता है. पोलार बियर भी 6-6 महीना कुछ खाता नहीं पीता नहीं. अभी साधु महाराज ये 14 साल हिमालय में तप करते बैठे, ऐसे माइथोलॉजी में खाना पिया भी नहीं और एक्सक्रीट भी नहीं किया, तो कैसे जिंदा रहे? So that is what is dormancy. Dormancy means zero metabolism, no intake, no output, still living. टीबी बैक्टीरिया को वरदान है, तो जिंदा रहेगा, will go in dormancy. इसके लिए सालों साल ये टीबी अपने बैक्टीरिया में रहेगा, and it will die when we burn. Hindus we get burned. ऐसे टाइम पे वो मर जाएगा, जलने के बाद वो मरेगा, तब तक अपनी बॉडी में हर पर रहेगा. सो इसके लिए देयर इज चांसेस ऑफ रिलैप्स आल्सो. रिकरेंस इज डिफरेंट, रिलैप्स इज डिफरेंट, वी कम टू डेफिनेशंस लेटर. सो टीबी एक बार घुसा तो वो अंदर सो के डॉर्मेंसी में चला जाएगा और फिर जब बॉडी का इम्यूनिटी कम हो गया या फिर उसका एक्टिव मेटाबॉलिज्म चालू हो गया, he will come back, I'm back. So there is chances of relapse in tuberculosis. So this dormancy is worst. In spite patient completing his complete course of anti-TB treatment, there may be few around 10 bacilli in the body which will go in dormancy. So this anti-TB drug will not act on it because they are dormant, they are not actively metabolizing. So no anti-TB drug can act on it. So they will remain alive, but they are not actively metabolizing. Understood? So what we have to do? Just keep a close follow-up. Maybe in 100 in one, maybe 1001 in one, there is chances of relapse. This is because of dormant bacilli getting reactivated again. So now what can be done? Nothing can be done. Just give long treatment of adequate treatment of minimum 6 months. Many times patient feels better of 2 months of anti-TB treatment and loses follow-up. He stops anti-TB. डॉक्टर मुझे अच्छा लग रहा है, मैंने गोली बंद कर दिया है. Because we have to explain him that there is a chance of relapse, so he has to complete the 6 months treatment. So understood? So why the 6 months treatment is required? Okay. So what are the mycobacteria other than tuberculosis? They are called as NTM, non-tuberculous mycobacteria. So in the phase of HIV, NTM, non-tuberculous mycobacteria, there are 4 types in it: photochromogens, rapid growers, and non-photochromogens. So these are the types, but it will be discussed in different chapter. But they are also acid-fast bacilli. So they are acid-fast staining, but they are not tuberculosis. So they are non-tuberculous. The presentation is different, the patient criteria is different, but you should be aware of this NTM also. Now coming to primary tuberculosis. TB is initially was discovered by Robert Koch. ऐसे बोलते कि इसको कॉक्स हो गया है, ये कोड वर्ड है. पेशेंट इमीडिएट टीबी बोला तो थोड़ा डर जाता है, या फिर एक रूटीन एक स्लैंग हो गया है, कॉक्स हो गया है, सो टीबी हो गया है, ऐसे समझ लो. बिकॉज रॉबर्ट कॉक्स, दिस साइंटिस्ट, discovered this. He was he discovered that TB bacilli on the microscope by Zdenstein. So this is Koch's also. Okay, it's more or less same. So how will you detect it? By Zn stencil Nelson stain, that is acid fast. They are very difficult to get gram stained. So there is new type of stain, that is acid fast stain. We can pick up this bacteria by Zn stain. AB positive, acid fast bacilli positive. So this is the common thing. But even the dead bacilli can be seen as the acid fast. So many times patient is recovered from tuberculosis. Few cavities are there, which can be coughed out. They are dead bacilli. So what is the gold standard to diagnose tuberculosis? Anyone? To grow the bacteria in the culture is the gold standard. Like in typhoid, what is the test? Blood culture growing typhoid is the diagnostic test for typhoid. Like that, the growth of tuberculosis bacilli in the culture is the diagnostic test for tuberculosis. Because it takes time, it's time consuming. Now, initially there was culture media, TB culture. First there was LJ medium. It took months, 1 to 2 months for the growth. Then again the growth, and after growth drug sensitivity pattern. So culture and sensitivity took more than 2 months. Culture sensitivity is required for any bacteria to get diagnosed, and we have to find the drug sensitivity also, to which drug it is responding. So it is difficult. So now The latest is MGIT culture. MGIT culture sensitivity. So it takes around 10 days. It utilizes radioactive carbon atom to pick up the growth. So this MGIT culture is very important, and rapid, these are rapid culture methods to pick up growth. Now, more rapid than these are gene expert or nucleic acid amplification test. These are the methods to pick up tuberculosis. It can pick up possibacillary states also. So microscopy and this NAT test are the very important tests to pick up tuberculosis. The results are available in less than 1 day, and it can pick up RIF resistance also. So rifampicin resistance, it can pick up Mycobacterium TB present and rifampicin resistance absent or present. If Mycobacteria TB is present, it can pick up if there is rifampicin resistance also. So in one test you can pick up two things. Rifampicin is most important drug is in anti-TB treatment because it is bactericidal and the best drug available for tuberculosis. So nucleic acid amplification test, in this a gene expert is there. Then ultra, it can around for gene expert around 125 bacilli should be required. In ultra it should be around 20. So it can pick up very few bacilli also. It amplifies the nucleic acid. Like in COVID, you used RT-PCR. It's the same technology. Even a smallest bacilli can be multiplied and amplified. So if we could pick up COVID. This test is prior to COVID, but now RT-PCR you know, but before that also that gene expert was available. Now latestly gene expert ultra is available, which can pick up even the smallest possible count. So these things we should know and should be utilized. Now latest guidelines say that you should know what bacteria is present and culture should define is it rifampicin resistant on day one of start of treatment. Latest recommendation is that. We'll come to the history. Now Government of India Tuberculosis Control Program, National Tuberculosis Control Program. Early it was National Tuberculosis Control Program. Then revised National TB Control Program. It is also called as DOTS treatment. It is alternative treatment. Initially, when we were students, DOTS was there. Directly observed short course, DOTS, directly observed treatment short course. So it was treatment of 6 months only, but it was alternative treatment. But again, it is revised now. This DOTS is stopped now by Government of India. Now, National TB Elimination Program. Now, from 2020, it's there. In DOTS, now for TB treatment, it's very complicated thing. So TB treatment, it's 2HRZE plus DOTS was having 4HR. Initial 2 months, 4 drugs, Then later 4 months, two drugs. So that was dots. Now in latest guideline, they had this is intensive phase, this is continuation phase. Now they had added ethambutol in the continuation phase also. This is the main difference between. Now we'll discuss these drugs later, but just get oriented to what is intensive phase. Intensive phase means for initially 2 months the bacillary load is quite high, so drugs will be more, and then later the bacillary count will be low. So pyrazinamide is omitted from that continuation phase. Now Z is pyrazinamide is active in acidic medium. So pus is acidic. So initially 2 months you give pyrazinamide. In acidic, there will be no acidic medium anyway. So pyrazinamide won't work unless it is drug resistant tuberculosis. I am talking of drug sensitive TB, rifampicin sensitive TB. I am talking of routine tuberculosis case. MDR we will discuss later. We will discuss definitions later. So understood intensive phase. It is a now why four drugs? Why not only one drug? Why not only isoniazide or now we will discuss few drugs. H R Z E. It is called INH, arsen, pyrazinamide, and ethambutol. Now isoniazide, pyrazinamide, and now many times this ethambutol is confused with